Urinary incontinence is the involuntary loss of urine. And that occurs when a woman least wants it to happen, so that it can happen when she's laughing or coughing or sneezing or doing some sort of straining, lifting, something like that. That usually is in a very small amount, but it's very annoying. And then there's something called urge incontinence, which goes along with when you feel the need to go to the bathroom and you can't quite get there. And that really happens when your bladder has what's called an uninhibited contraction, that the muscle of your bladder, which is called the detrusor muscle, squeezes when it shouldn't be, when you're trying to tell it not to squeeze. That kind of incontinence tends to produce a large amount of urine and often will soak through somebody's clothes.
Okay, so there's obviously going to be different treatments for the different types.
If you're talking about somebody with stress incontinence, one of the things that women can do to help themselves are Kegel exercises. And that involves squeezing the muscles, which are called the pubococcygeus muscles, that hold the urine in. And if you can't really quite identify what those muscles are, when you go in for your annual pelvic exam, ask your practitioner to help you squeeze those muscles, so identify what the correct muscles are.
And the medications?
Medications are helpful not so much for the stress incontinence, but for people who have urge incontinence.
So is surgery a last option?
No, not really a last option. It really depends on what the person needs. There's surgery, and there's also a device called a pessary, which is a rubber device that can be put in somebody's vagina to help support the tissue in there if the reason why they're having incontinence is because things are heading a little bit south for them. And surgery is done often as an outpatient, so it's done as a mesh procedure, and people put a little bit of mesh to support the urethra, that tube going from the bladder outside, and they give a little bit of support to that area. There are also other procedures that put bulking agents, such as collagen. Just like we get collagen put in our wrinkles, well, you can get collagen put around your urethra to help support the urethra and help with some of that stress urinary incontinence.